So I want to start by asking a question. When was the last time that you had a difficult or uncomfortable conversation? How did you feel? How do you think the other person felt? Was it when your parents sat you down and talked with you about the birds and the bees? Was it something at work when you had to let someone go or talk with someone about their poor performance? Thinking about how those interactions work and how your emotions and their emotions play into it is a big part of healthy mental fitness moving forward. So I want to talk about that. I'm going to delve into a little bit about the science behind it, tell you a little bit about me, and then talk a little bit about where we're going with this. So my name's Matt. I'm an occupational epidemiologist. Our company, SafeLane, we are here to help provide those insights, those light bulb moments of where you're having the difficult conversations, but it's not difficult conversations with other people. It's those difficult conversations you're having with yourself. Those times when you sit down and you need some level of introspection. You need to sit down and think about, why did I behave that way? Or why am I feeling like this? And then ding, there's your light bulb. There's where you can make a change and move forward. I have my PhD in occupational epidemiology. That is, I study health and work and how that overlaps with an individual. My specialties are mental health. I've done a lot with COVID-19, musculoskeletal disorders and transportation worker health. So truck drivers, railroad workers, even airlines. Within your working environment, there's so many different challenges, and being able to address those challenges in a productive and meaningful way is important. And one thing that science is understanding more and more is the role that your mental fitness plays in how you behave both at work and outside of work. So how productive you are, what you can do, how you influence those around you, whether that's your family or your coworkers, your boss, your clients. All of those things go into this mental fitness and your ability to sit down and ask yourself those challenging and sometimes uncomfortable questions about how you're feeling and how you can move forward with these things. So let's talk a little bit about mental health. I'll be going into more about mental health in a webinar that we have coming up. So keep your eyes peeled for that. But I just want to touch a little bit about mental health and what science is telling us about what we have going on, right? So recently I've finished a 4-year analysis of all of the literature looking at mental health. We've done post-traumatic stress disorder, depression, and anxiety, which are the 3 big ones right now, and traditionally have been the 3 big mental health and mental fitness concerns. So we looked at both the best ways to diagnose them as well as the best ways to treat them. So looking at that and figuring out how can we get our arms around this and how can we give individuals tools to both make decisions about, am I having challenges in mental fitness, or am I doing things well and what do I need to keep doing? And how can I improve? What are some treatments? And a lot of the best treatments out there are not costly, they're not time consuming. Sometimes they're things like aggressive physical activity, moderate or vigorous physical activity 3 to 5 times a week for 30 minutes is statistically demonstrated to have a positive impact on your mental well-being, whether that's depression or anxiety. I'm also working with the Utah State Bar in looking at attorneys' mental well-being and mental health and helping them craft ways to move forward. So we're looking with attorneys, judges, paralegals, and other support staff, as well as law students, which is really a lot of foundation for where we're going with this and SafeLane with mental health. So let's talk a little bit about what we know. Most common disorders in terms of diagnoses are based on 2018 data. We unfortunately don't have anything new. With this environment that we're in right now with the pandemic, obviously there's a lot of additional challenges, but anxiety, depression, and then this other category are really the most common, by far the most common diagnosed diseases before the pandemic. Initial data that's out there in research is suggesting that this has actually just been exacerbated, and these may be as high as 60% higher than what they were previously. Now that doesn't apply to everybody. Different groups, different industries, different types of individuals may be going up and down. The pandemic and challenges may actually have some improvements for some people. I was just talking with some lawyers today on the phone, and one of them brought up how she really loves how she's stuck at home because she gets to spend time with her kids. Before, she had to go to the courthouse every single day, and she missed being with her young children who were 3 and 4 and 5 years old. I think just 2 kids, 3 and 5 years old. So thinking about, how is your mental well-being and your mental fitness being impacted by your behaviors, and what can you do to move forward? Let's talk specifically about Utah and what we have going on. In Utah, the depression rates are meaningfully higher than the rest of the country combined. So when you look at these numbers, there's also an uptrend if you look at that. So Utah is the light blue, the rest of the U.S. is the dark blue. Again, we don't have current data, but looking at the past, meaningful numbers here in terms of how prevalent depression is, and then just overall poor mental health, which includes a whole bunch of other things aside from just depression, is seeing a meaningful uptick in Utah as well. Lastly, I wanted to show some data about the mental health impacts on financial issues, both individual financials as well as a company's financial bottom line. So the light blue line talks about, the financial impacts, the prevalence of financial impacts among individuals who have severe mental health concerns as compared to those who don't have severe mental health concerns. And you can see in all 4 of these different categories, the mental health concerns are twice as high or even higher than those without mental health concerns. So addressing mental well-being and mental fitness not only is good for the individual and good for those around the individual, but it also can have a very positive impact on the bottom line and actually be a very smart financial move for companies. How do you have these tough conversations with yourself? How do you have an introspective conversation or assessment with yourself that can help you identify things that you're doing well, but also identify things that you can improve upon? One solution is this evidence-based help that we have at the lightbulbcure.com. So this is a website that we have set up where we have a comprehensive mental health assessment that covers many different domains to help facilitate that conversation and really do an assessment about where you stand and where you can improve. So it covers domains of depression, anxiety, burnout, which are all negative things that we want to get rid of, but also positive things like engagement. What are you doing well to engage with others, whether that's virtually or in person, as well as satisfaction with life? What are the elements in life that are helping you thrive and giving you satisfaction? All of those domains will be assessed through a series of questions that you can answer honestly. All of these data are completely confidential. Being a researcher, to me, confidentiality is by far the most important aspect of any data collection element. So by providing this information, we will have these tools which give you essentially a score for each of those domains and potential recommendations for things that you can either continue doing that are doing well or ways that you can change to improve and make you better. These are evidence-based recommendations based on tried and true health assessment tools, mental fitness assessment tools that have been vetted within the literature and have showed strong relationships with how diagnosing issues and improving. We invite you to go to the lightbulbcure.com, take this health assessment, know that your data are completely confidential. We're not going to disclose any individual data to anyone. We are going to look at it and provide some aggregate information, looking at total population so that policymakers and others can use that data to help make decisions. But all of your data is completely confidential, and that's very important to us. So we want to empower you to be able to make decisions and provide you with resources, additional resources, to be able to move forward and shine bright for others. So that's it. Thank you very much on behalf of SafeLane Health and all of my colleagues. We hope that you stay mentally fit and continue to stay mentally strong. and join us for our webinar. Thank you very much.